May. I'm the Director of Business Development for SoftWave, and Dr. Ben Weaver is one of our early adopters of SoftWave in podiatry. He and Dr. Lada were, I think, my first two that I convinced to give this a shot, and now it's grown to, gosh, probably 70 podiatrists now, so we're really starting to take off. Just wanted to go through, we're going to kind of tag team on this and go through the science, a little bit behind the science of SoftWave. And then we'll get into some financials, and in the middle, Dr. Weaver's also going to go through some of his patients that he's been treating. So you'll kind of hear from both of us as we go. And then afterwards, we're going to actually have two machines. And so if anybody has any pain or anything they'd like to treat, we're going to be doing some treatment. So please, we give you a chance to get some hands-on experience and get treated yourself so you can feel and have the experience. Let me see if I can get this going. So, Dr. Weaver, you want to?
All right, so most of us in our office, we're going to see the tendinopathies. We're going to have decline in revenue. So this is can be a cash service or insurance service you can add to your practice. People are wanting to avoid surgeries. Again, what we were talking about earlier is that most people don't want a surgery if they don't have to. And if we can prevent it, ideally, that's the best option, especially for elderly population that we have. This one device here, I don't say it's a game changer, but for all the different things it can treat, it really is. I looked at it first for wound care in my clinic because we do a lot because I knew I could get additional treatment with their wound care, and then you can do soft tissue, which soft tissue is neuropathy. Anything that hurts, you can treat with this device. So it was a multi-focus, just like with a RIMI laser. I can look at multiple things. I can look at fungal toenails. I can look at warts. I can look at neuropathy, pain, all these different items. I'm looking at devices that can do a multitude umbrella of what we can use it to treat wise. So let's go to the next one.
Yeah. There we go.
All right. So basically, when you look at SoftWave, it's doing a lot of different things. The way I describe it to my patients is imagine your cell is a water balloon. We're taking it and we're slapping the outside of it. The body thinks it's getting hurt. Your body sends out these little signaler cells in there to recruit your body's own stem cells. We have mesenchymal cells inside of our body. It just helps direct them down to where the injury is in that area. It helps regrow, angiogenesis, blood flow to the area. It's going to be, growth factors in the area and just remodels tissue.
So I'll explain this slide. So there is a history behind this. Shockwaves have been around for over 50 years. A company called Dornier, who actually made fighter jets years ago, had a problem with airplanes when they would break the sound barrier and they would get cavitation and disruption on the wings, a little pitting on the wings, and would rip the wings off, so that was a problem, right? So that's kind of where the swept wing came from. But one of the things that they found was that they were trying to figure out if they could coat the leading edge with like a ceramic covering to help stop that, and it was just cracking the ceramic. So they started saying, some physicists said, well, what if we took those shock waves and we focused them on a kidney stone? How could we, could we pulverize a kidney stone and then get it to pass non-surgically? And that's where shock waves came from many years ago. So they would focus, put a patient, it was in a hospital in the late 80s, early 90s, and you put them in a tank of water and had a big bulb, much like that, but only larger, and they would focus these sound waves on that kidney stone. It would pulverize the kidney stone, and the patient would pass it without having to have the surgery. So it was great, but it was large and expensive and took up a lot of room. But what we found, and so then many years later, some of you probably have heard of orthotripters. So as technology advances, the machines get smaller and smaller. Then they had one that was like a mobile x-ray. You still had to be under anesthesia, used it for plantar fasciitis. They would take you into surgery and do the shock waves, and at one time insurance paid for it and then stopped paying for it, and so everybody moved away from it and started doing more injections and surgery. So it's not that this is new technology, it's just that it's changed over the years, and just like cell phones, the machines have gotten smaller, and now we've moved it to what's called low energy lithotripsy. So true shock waves are low energy lithotripters, so they're just not as much energy as the ones that we use to pulverize, and we have found some other changes that needed to be made to get the benefits, which I'll go into in a couple more slides. But there's a big difference between shock waves and pressure waves, right? Even though this is an acoustic sound waves and is creating a super high pressure, it's creating pressure that is like upwards of 100 megapascals, which I'm not a physicist, I don't know that, but if you know what that means until somebody explained it to me, but we're talking like 10 to 14,000 pounds per square inch. That's like the pressure at the bottom of the ocean for a nanosecond, okay? And when you get that much pressure, but then if you see there's a negative tensile phase, but it's very shallow, so you're getting a positive pressure for a nanosecond and then a negative tensile phase, but you're not creating a lot of cavitation. So you're getting this compression and stretching of the cells at the cellular level without causing damage to the cells, okay? So that's the difference between, and I'll show you a difference between this and a radial pressure wave here in the future.
So these are basically, when you look at that mechanical energy, you're going to produce the angiogenesis, you're going to activate your own stem cells to come down, you know, when you're having all those growth factors that are recruited to the area, and then that helps remodel the tissue. So when we talk about, you know, regenerative medicine, these are layering of effects. So SoftWave gives you one layer of effect. Then if you're putting, you know, some type of biological in there, it's like fertilizer in that area. So you're getting a double effect. Adding peptides on layer on top of that. So you put all those pieces together, that's the fastest you're going to get the body to heal itself.
I think my Bluetooth is, yeah, you want to help out, Mark? Because it's connected and then it's not connected.
Just one finger though.
Nope. It exited. Sorry. Okay, so this is the mechanism of action. Again, we went through a little bit of that on the previous slide, but basically you have that compression and stretching of the cells, which is the physical phase. You're causing the cell shearing, the signaling. You're waking up the cell. It thinks it's been injured, but it hasn't. So it starts the toll-like receptor 3 pathway. During that phase, you're getting that chemical phase where you're getting we say modulation of inflammation, right? Sometimes inflammation is good. We talk about that. Sometimes we want to, you're recording me. There we go. Okay, sorry about that. So then you get into the chemical phase. So this is the activation when the cells start signaling the rest of the body. I need nitrous oxide increased. I need VEGF. I need you to send me stem cells to the area. And then the biological phase is when those things do arrive, then it starts building new blood vessels. You get that modulation of inflammation. Sometimes inflammation is good. Oftentimes it's bad, so it depends on if you're in an acute or chronic phase. But we modulate, so it's just reactivating the body, and you're doing that once a week, and you're reminding the body to get out of that chronic phase and keep that healing ongoing.
So this was, thanks to AI, is probably one of the best explanations we have for how SoftWave works on a cellular level. I showed this to all my patients before we even start.
SoftWave is the only device that utilizes patented parabolically focused shock waves to effectively treat pain. This technology generates electrohydraulic parallel acoustic waves that provide the largest and deepest therapeutic treatment zone. Soft waves trigger a biologic response up to 12 centimeters from the spark discharge and initiate healing at a cellular level over the broadest possible area, dramatically reducing pain with the fewest number of patient treatments. What is soft wave therapy? When treating a patient, the provider will begin applying SoftWave looking for any inflamed or painful areas. Once they have identified the inflammation with patient feedback, the clinician will provide shock waves until the discomfort has been reduced or eliminated. The pain relief is the result of multiple mechanisms of action, including the modulation of inflammation and neovascularity. Because SoftWave delivers therapeutic levels of acoustic energy over the broadest treatment area, SoftWave therapy will always require the least number of shocks, the fewest treatments, and superior outcomes with the least pain, at energy levels that do not cause cellular trauma or injury. Other devices utilize either radial pressure waves or highly focused shock waves that have a limited diagnostic and therapeutic capability. These alternate technologies will always require more shocks, more treatments, and are painful. How does it work? SoftWave's acoustic parallel waves activate cellular receptors, initiating the body's own natural biologic healing response, non-invasively and without drugs or injections for pain. This process is called mechanotransduction. Mechanotransduction reported benefits include angiogenesis, the recruitment of stem cells and activation of resident stem cells, and an increase of production of proteins, and increases cellular permeability, resulting in the release of exosomes and the shedding of microvesicles into the extracellular space, signaling the body's natural regenerative processes. This also limits the response to the targeted inflamed or ischemic tissue. The tissue's natural immune response is also activated, and proteins like interleukins and other cytokines begin exiting the bloodstream and make their way to the affected area. This ensures a more efficient and targeted response, limited to the inflamed or ischemic tissue. SoftWave is the only device that utilizes patented parabolically focused shock waves to effectively treat pain. This technology generates electrohydraulic parallel acoustic waves that provide the largest. SoftWave is the only device that utilizes patented parabolically.
There you go. Okay, well, we already talked about that. Go ahead and skip that slide. We can move forward. Okay, I'll talk about this. So there's many different ways that you can create shock waves. And it is very confusing in the marketplace. I think many of you probably have radial devices or have used radial devices, but again, the International Society of Medical Shockwave is now considering radial waves considered as their own category, and that's RPW, or radial pressure waves. So you can see at the bottom, that's basically a hammer. You're taking an air compressor and shooting a little metal pin down. It's hitting a little metal plate, okay? It can be very painful. It takes a lot of shock waves. I'm not saying that they don't have a use. It's great for calcifications and superficial, but it's not very deep, and it's not considered a focused shock wave. The rest of these are considered true extracorporeal shock waves. In other words, they're creating a super powerful shock wave, like I said, that could pulverize the kidney stone, but not at the lower energies. But there's still a difference. SoftWave is an electrohydraulic. That's the most powerful of the shock waves. That's what was developed many years ago for the kidney stones. And then there's another way you can create shock waves, and it's a piezoelectric. That's just sending electric through crystals. It's one of the weakest of the shock waves. And then electromagnetic. And that would be like your stores unit, which is good, but it's kind of in the mid-range. There's this thing called an energy flux density I won't get into, but we can talk about that at some other point. It's very confusing. But the most important thing about the shock waves is, as you know, SoftWave has the parabolic. It's at the top here. You see it's electrohydraulic, so it's the most powerful, but we're not focusing the shock waves to a point, something the size of a Sharpie. We're actually slightly broadening that wave, so that allows you to have less pain, still have really strong, deep penetration, treat these larger areas so that you don't use as many shock waves, because all of these have to have the applicators refurbished from time to time, and so you use less shock waves. And then also, we have an indication for wound care. This is why it's important, because as you'll see in the next slide, before we go forward,
This is basically, if you're looking at SoftWave, this is basically your unfocused energy as far as the surrounding size of it and the depth of it versus a focused machine, which is, basically the spark on this starts back in here. So your energy level starts all the way out. The touch of the skin is why we can use it on wounds versus where this, if you look at the focus unit here, that focus starts out here. So you're already through the skin layer and the bone layer before a focus machine ever starts. So that's for a much deeper, back, shoulders, knees. I mean, this is not going to function very well.
go ahead and show that next slide, Mark. This is kind of it as a representation. This is the SoftWave at the top. You can see the spark starting back here at the very front of the applicator. You already have an effective wide and deep penetration, but that's why it works for skin. As you can see on a focus device, you're actually not, your shock wave has to converge before it gets strong enough to actually create, you know, a beneficial energy, okay? And then lastly, this was the graph I showed you earlier that is the really high pressure wave with the low tensile, negative tensile phase versus the pressure wave. Like I said, is just a hammer. It's more of an oscillating, but can have, you know, if you're trying to create a bust up a calcification, things of that nature, it works very well for that. But for softening connective tissue remodeling, not so good.
So basically for, you know, podiatry uses, you can use it for wound care, neuropathy, Achilles tendonitis, plantar fasciitis, posterior tibial tendonitis, you know, arthritis, neuroma, capsulitis, neuroma, and I think what all those, you know, foot ulcers. I mean, that's everything that we treat in the foot, you can pretty much use this one device for. So, yes, sir. Yes, well, it depends on your area. You know, that's, you know, Chad can answer those questions for you, what MAC you're in. I'm in WPS, and so for each treatment, you know, there's 2 different codes. There's one for wounds, which is 0512T, and there's one for soft tissue, 0101T. For both of those in my area, it's $320 per treatment on that.
Go ahead, Mark.
All right, so these are just a couple of wounds we went through. I mean, this is kind of what we see every day in our practice. I mean, you've got the wound here, diabetic walking around on it, barefooted in the house. You know, we started debrided it, collagen. We use UltraMist in our practice, and then we were also adding in SoftWave at that time. So usually within, we were doing the UltraMist 3 times a week, SoftWave 3 times a week. So you look at those numbers, $700 for, you know, UltraMist, $300. So that's $2,100 a week for a wound, plus your collagen that they're changing at home. So this exponentiates your wound care. And it gets the patient better a lot faster with doing that. So this was after 4 weeks, completely remodeled. This wound had been open, you know, I think for 6 weeks before they came to see us. You know, it was, you know, pretty much epithelialized and closed in 4 weeks. You know, it can also be used for venous leg ulcerations. Again, the white stuff over here is collagen, but, you know, this was in 1 week. You know, if you kind of look at the wound on the left-hand side here, it's an E. With an Uniboot, UltraMist, treating the middle E, now it's an L or a V. You know, that part's gone. As far as the healing factors, as quickly as it does, it's amazing on that part as far as wound care goes. This was the case that sold me on SoftWave. Guy came in, he had already lost his right leg, so he had a BKA. Left foot, he had an ulcer on the top of that toe. A1C was 16, refused to go to the endocrinologist. We treated this for 9 months, but how many times can you close over bone? Has anybody ever, you know, without any grafts? He was revascularized 6 times because he kept blocking off the stents. So every time we'd go through, we'd get it almost closed, you know, another vascular event would happen over and over and over again. When he left my practice, no ulcers. Went home 4 weeks later, you know, decided he didn't want to do anything again, and, you know, had the other leg, you know, had ulcer, blocked off, stents again, and amputation of the leg. But he left my practice. He had all 5 toes. But I had never seen anybody with that many risk factors and comorbidities we were able to heal. So to me, that was like a feather in SoftWave's hat. Again, you know, distal clevi with the ulceration, you know, offloading the area, you know, collagen, debridement, offloading, SoftWave, UltraMist with that. Again, within just a few weeks, I'd pretty much epithelialized at that point.
Yeah, I was just going to speak to this. I'm not going to flood you all with a bunch of research and studies, but the website is very good. We have a research tab if you want to go there. We have a lot of interesting research. Also, you can, you know, search PubMed. Obviously, this technology comes from Europe. It's got thousands of studies out there associated with shockwave therapy, including SoftWave, of course. This is Dr. Martin O'Malley. He's at the Hospital of Special Surgery. He's also the team foot and ankle surgeon for the Brooklyn Nets and the New York Giants. He has a couple SoftWave devices, but he was part of a plantar fasciitis study with our device, and so that's a good one. That's on our website if you want to check that out. If you need anything, obviously you can reach out to Mark or I, and we can supply you with those studies as well.
So this was one of my patients here. She came in and she was a professional speed walker, 77 years old. She came in with a very specific problem. She said, I have 3 fibromas right here. I want them gone. I'm training for nationals. I was like, okay. I was like, we have solutions. She's like, I don't care what it costs. She's like, I just want to be able to compete. So, we did the DPMX in the area, SoftWave, red laser, orthotics, physical therapy, and she did really well. She came back a couple of weeks later. She's like, I'm still a little painful right here. And I was like, oh, you have plantar fasciitis. I said, I'm sorry. I didn't, fully work you up. I was like, because you said I have this problem right here. I want it gone. So basically, we repeated the same thing again with that and hit it. Good morning. How are you doing?
I'm doing wonderful.
So would you tell me your name and a little bit about what brought you into Central Kansas Podiatry?
Well, my name is Rosamond Gail Knott. I came in because I'm a competitive power walker, and I was getting ready to go to nationals, and I couldn't train. My foot was really hurting me. I had had an injury to it about a year ago, thought it was better, didn't seek out treatment, and I should have. It healed incorrectly. So I couldn't train. I had spent 2-3 weeks not training at all, hardly able to walk, and I was limping. So I came in and sought treatment, and I was able to go to nationals and compete. I came in 9th in the nation. If I'd sought treatment maybe a month earlier, I know it would have been better, but still I competed, and competed at a very high level. I also wanted to go to Wells and climb Mount Snowdon. I made it. Typical climb can take 5 to 8 hours, and my team made it in 6 hours. We were tired afterwards, but my foot held up. It did very well. Later we went down to London, almost 20,000 steps down in London that day. My foot did fine. I'm getting ready to start speed training again, and I'm going to go to Worlds. I'm so thankful for the treatment that I received.
So Gail, can you tell me a little bit about what the treatments we did here? Good morning. How are you doing?
I'm doing wonderful.
Did you notice when you're treating a fibroma, is there pain going away, or is the fibroma flattening out?
Fibroma flattened out, and she was having less pain in that area.
But you still feel it, right? You can still feel it.
They went from, like half the size of a marble down to like the size of a BB. So they went down quite a bit. I mean, we peppered those in that area with the DPMX, SoftWave them, and then lasered them afterwards. And we put her in a boot for about 3 weeks, mobilized her in that area. But she did really well. I mean, I would love to be in the shape that she was in at 77.
Dr. Weaver, can you talk a little bit about pain management after treatment? What's your outcomes with that, just like on that patient?
Pain management? I mean,
Like after, like post-treatment?
I have not seen her back. She said everything was great on there. As far as, of course, injections, because you don't want to, at least with DPMX, put any numbing agent in the area. So you're kind of you can field block around it, but not in the area because it's a biological. I don't think you want to mix lidocaine and stuff with your biologicals because, it kills some of the stuff that's in there. Do all that in the area, but if you look at SoftWave, it actually decreases your inflammation and decreases your pain level. I mean, time somebody finishes with a session, they should have at least 50% decrease in pain in their area. So they should walk out feeling better. It's one of the few things that we can do, kind of like taking an ingrown toenail out. People walk out and they're like, that feels better, thanks. That is the way, SoftWave works. You're gonna treat it in that area and they should immediately, when you're done, go, yeah, that feels a lot better. Now, is that gonna last? No. Every treatment you do is a compound. It will last longer and longer and longer each time we do it.
Thank you.
If you're looking at diagnosis, again, we kind of talked about it. Anything that hurts, works. Pretty much any type of wound will work for it. That will be there. So, we kind of done that.
So I just want to go over contraindications with SoftWave and shockwaves in general, but I also want to, take the time to explain something. But the contraindications are you won't do this over a pacemaker, not really affecting you all. You can still treat the feet and peripherally. You do want to make sure nobody has severe blood clotting disorders. This doesn't mean somebody that's been on Plavix prophylactically because they had a stent put in 20 years ago. We're talking about somebody that bumps their legs and gets blood clots. You want to stay away from somebody like that. So just make good, sound judgments. You're not going to do this over a fetus. You're not going to do it over a tumor or somebody with active cancer. That's pretty much it. There are some warnings. Corticosteroid injections, you want to wait a period of time, 21 days. NSAIDs, they don't cause any problems, but they interfere with what SoftWave can help do, so it can extend the healing process. So if you can get them off of their NSAIDs a few days before and then have them not take them for a few days after, that's best. And then growth plates in young children. Now, I preface this by saying a lot of the IFUs for shockwaves, because these are predicated 510Ks on other previous devices, were all on those high energy devices that we talked about. So it used to be a problem. So we haven't done a lot of studies, but we are doing research and going back to the FDA now to try to get rid of some of these because there are ongoing studies. In Austria right now, we have a study that you can scan next door or is on our website where they're actually using our generator and a smaller applicator, but right on the myocardium after CABG surgery and having a great, like, I can't remember the percent, but
it's like 20%.
20% increase in their injection fraction rates after doing 5,000 on the myocardium, and these people, so that's the difference with people at 6 months jogging without oxygen versus being in a walker and on oxygen the rest of their life. So it's very impressive. Yes, Karen?
Can you use this on someone taking anticoagulants?
Yes, I do.
Yeah, just make good clinical judgment. The question is, why are they on the anticoagulants, right? So just, like I said, if they're on Plavix because they had a stent put in, they're just taking something proactively. But if they say, yeah, I'm prone to getting a blood clot, by walking or something, see, you want to make sure you understand why.
So if you're looking at a high energy device, more of the focused devices that are there, that is pinpoint like a pencil, it's hitting straight in there. There is more bruising and, destruction in that area versus this is spread out in there. I've never had anybody that's ever had a hematoma or any type of bruising from this device ever, even, on anticoagulants. I've been using it for 4 years. Last year we had over 1,400 treatments, we used it on. So, I haven't had any of those. And as far as when we go back a slide, as far as, again, pacemakers, it doesn't matter if they have one in. We're not treating the pacemaker area. We're down here. People will ask about that. Active tumors, unless they're actively on chemo or radiation, you're pretty much okay. If they're in remission, doesn't really matter on that part. It's not an active tumor on that part. When you look at the corticosteroids, I know it says 21 days. I make people wait 6 weeks, because you're wanting to get an inflammatory reaction in that area. No NSAIDs. Growth plates, I have used them on children, for receivers and stuff because they're soccer players, they want to get back. Heals it up pretty quick for them.
Okay, let's talk about the finances and then we'll get on to playing with toys, okay? So you guys are already the kind of providers that, you're looking beyond reimbursement. I want to say that SoftWave is probably a great hybrid for many podiatrists because, it's really hard. Whenever being a salesperson and educational, talking to clinicians, when they say, yeah, I'm 98% insurance and I want to jump into a cash business, I'm like, oh, turbo, slow down. Yeah, what's your plan, right? Because, you don't just do that. I know you want to make more money and all that, and you're tired of insurance, but you got to have a plan. So I see SoftWave as a great hybrid for your clinics to help move, and that, at least in the areas where there is unallowable by Medicare. So you're looking beyond reimbursement. You're looking to explore a model that builds outcomes, autonomy, and trust. I think you guys were just talking about that before this episode, or before this training session. Give your patients options. You're going to build trust. They're going to come back, right? And they're going to be willing to pay cash. You jumped ahead. I had one more. Yeah, and then again, SoftWave was designed for you and your patients. So, okay, Mark, sorry. So profitable and quick. We talked about this earlier as well. Capital investment for these machines as they sit right here. These are our LI500s for podiatry. I suggest this machine because it has 500,000 shock waves per applicator. You can purchase this on a payment plan of about $1,700 a month, okay? They mentioned this earlier, it's about 1.5 patients. If you have 1.5 Medicare patients, but cash patients as well, most people are charging somewhere between $1,200 and $1,800 for cash treatments for a package of 6 to 8 treatments, okay? So about 1.5 patients, regardless if it's a Medicare or a cash patient, to pay for the machine. And the average cost of operating, as Dr. Weaver said, is pretty low, pretty minimal. It's about $6 per treatment for the ongoing refurbishment of the applicators if you were to break that down by treatments. And it's about an average of 10 minutes per treatment. Most states, you have to follow your own local laws, state and local laws. But for instance, in most states, you can have your EMAs doing this treatment as well. Once they've been trained by us, we come in, we FDA certify, and we spend a day with you training you and your staff, and then you can have your medical assistants. But in many states, you have to either be on site or at least overseeing the protocols. So you just have to check with your own local bodies on that. Okay, Mark. This is kind of a busy slide. I want to just focus on a couple things on here. So you're going to be, we talked about charges per treatment and the cost at $6, but you're going to be somewhere in this between $200 and $300 per treatment, but you're going to sell packages, right? That $1,200 to $1,800 package, and then Medicare's reimbursing around, say, $300. So if you look at that and you look at over here at the, kind of the net income, your SoftWave can drive about $220 to $370,000 for your practice per year, okay? And I'm going to break that down in examples next, okay? So don't worry about this slide because it's a little bit busy there, but. Okay, cash example. These are kind of a little bit low, but I like to be on the conservative side. Let's just say that you're doing 10 treatments a week, 4 weeks a month, at $200 per treatment, that's $8,000. Your cost, as we talked about for your machine, is $1,700, and then you have a $6 ongoing cost at 40 treatments, which is $240. Your net revenue for that month would be, this is not for your overhead and your patient staff, your staff to treat your patients, is about $6,000 per month. So that's, kind of conservative, but that's annual revenue of $72,000. And if you think about that, these are 10-minute treatments. How much is, very 5-minute, I'm hearing 5-minute treatments over here right from the boss, but I always like to be conservative and say 10 minutes, but they're very quick.
Okay, 7.5.
Okay, so split it is 7.5 treatments. And your medical assistants can do this for you in most places. So $72,000 for very minimal time per week at that rate. So go to the next one. Now we're going to shift and go to Medicare. So if you were to charge basically the same layout here at $300, which on average, some places it's $340, some it's $300. I'm sorry, California is $22, but hopefully that will change in time, right? Once we get more further down the road, I'm sure other MACs will come on board as well and be reimbursed, especially now that on the wound care side, skin subs are taking a beating. People are going to be looking for opportunities and ways to treat patients with things that can generate revenue, and this is a lot less costly way of doing that than skin substitutes. So 10 treatments per week, 4 weeks at $320 is $12,000. Same costing, $240. Your net revenue, $10,000 or $130,000. Same amount of treatment time. And then we have Dr. Weaver's slide. He does 7 treatments a day, about half for wound, half for, I guess half, I'm speaking for you, but about half and half wound, half musculoskeletal. He has a combination of both cash, and he charges about the same for cash as Medicare reimburses. And so we're just kind of averaging that at about $300. So he's generating about $42,000 per month with his costing and his device payment out. That's $39,000, or about somewhere between $400,000 and $500,000 with one device. He now owns 2 devices. He just recently bought a second one. So here's what we talked about. Pricing, $79.5. We'll do a show special. If anybody wants to talk to me or Mark today about one, we'll do it for $75.5. You get 2 applicators, 2-year warranty, day of on-site training. We come to you and spend time with you doing the training and training all your staff, and you get a certificate for that. We also are given a year of Data Biologics. Data Biologics is a company that uses surveys to collect data from patients ongoing and then give that information back to you, and so you have access to it. We have a lot of orthopedic surgeons that are using this as well. But what's really nice about that is you can get your own data as well as see kind of the national averages, but it helps you sell cash businesses because you can sit down with a patient and say, look, I treat this same condition with SoftWave, and we have a 95% positive at 12 months out, right? So it collects that data over time, and you can use that. So that we'll pay for that for a year for you to help you. And then we have lenders that we work with, and they'll most likely, most of them do no money down, 6 months deferred. So your first 6 months are either $0 or only $99 a month. That gets you in and lets you start using the device and generating some revenue before your first payment. And then you're at that $1,700 a month. And you can choose 60, 72, or 84 months on your terms. The $1,700 was at 60. It would go down a little bit but then you're paying more interest. They also, most of them will do after 1 year. You can no prepayment penalties. You can pay off the device and just pay the principal. Okay. Questions? Okay. Yes, sir.
Is this portable? Does it come in a case that could be portable?
Yes, I don't have one here because I travel through the airlines, and TSA is mean, and so are the Delta people. So I have kind of designed my own, but it does have a transportable case with wheels. You're talking about an $80,000 unit. I'll be happy to, if you have 2 offices, I'll happy to sell you 2. But no, you can move it between locations. I fly with it. I travel all over. It's about 43 pounds as it sits. We can help you identify carts. Dr. Weaver helped him get some specialized carts. We put batteries on his so that he can move it from room to room versus taking patients and putting them in. So we'll work with you and help you design all that so his staff can unplug it, move it to each room, plug it in, and keep going so they don't have to power it down or anything.
Every time you would, like if we were treating right now, you would have to power it down, drain the head, unplug it, and move it. So like I said, we have the carts. I put a big battery backup on it. And so we can just unplug it from the wall and move. The machine stays on, and I can roll between rooms in there. And so for that part, if the power goes out, I can still treat probably 6 to 7 treatments on that battery backup if that were to happen. But if you were doing like a nursing home facility or something, you could roll between room to room to room and keep everything going. So that does speed up that time rather than draining it each time you go.
Yeah,
Does anybody have any musculoskeletal pain right now?
Get that toe. Get over here. Look at that toe.
Your toe? Okay.
Yeah, we're doing hands on words. Any other questions? We're here to answer anything. If you want to pull us to the side, we'll break up into 2 teams. If you guys need to take a break or run out, but feel free. Dr. Reed will do some treatments over here. Mark can do some treatments over here. I'm here around for any questions. I want to thank Laura Lashinsky is back here. She's our marketing chief of marketing for SoftWave, and we appreciate her helping me with slide decks because she's way better than I am. And that cool video that you saw, we have that type of stuff available when you buy a machine that you can run that in your lobby. We have marketing materials that we've created that you can print. Trifolds, things of that nature, but also things like marketing jumpstart kits, emails on how to send out to all your patients to get them to come in and let them know that you have it. Because believe it or not, people are looking for SoftWave. We have a very intelligent, and with digital marketing, people know about SoftWave. So I have a lot of orthopedists starting to call me saying, look, I'm losing business because they're going down the street to somebody who has a SoftWave. They're asking me about SoftWave. So, hey, you know, great. But if you can have that information, you can get it out. You probably have people that might be going to a chiropractor to get plantar fasciitis taken care of. You don't want to lose that opportunity. You want those patients to come to you.
So just
Okay.
a quick thing I will say, this dog injured his foot or toe 4 days ago, about 3 days ago. Classic sports acute trauma. One of the things Chad didn't mention is in the last 2 years, we've placed this in every NFL team in the United States. And but one. That one, I know that. Both mentioned that.
Yeah, a lot of them. The last 4 that were in the run for the Super Bowl, I don't know,
So the reason is,
not Kansas City Chiefs, by the way. I have some work to do.
I was going on recent information from sales. Sorry. But I will say the reason that has pivoted for us is because you heard a little bit about inflammation modulation with this system. True shockwave energy actually causes the tissue to, as we say, modulate inflammation. We have many, many videos on our YouTube channel that I suggest as professionals don't believe us. You can tell who the pros are talking about our machines, and they're not paid for by software. They're talking about what they are seeing for outcomes in their athletes and why, and that has been sort of the precipice that's pushed us over the edge with the pro teams and acute sports injury management, and we suddenly have this incredible following. So,
We've got 2 machines that are
Chad, can you do me a favor, just run this because I can't get the machines, because I don't know where it's. So normally you have the patient sitting on an exam table and you spread your ultrasound gel. I know he's injured, so I'm not going to go.
What hurts?
I want him as a naive patient to this sensation, to experience the shock wave in an area that he's not playing. So I'm going to go up right on, medial aspect of the leg, give him a quick tap. What does that feel like to you? Like it's tapping on your skin, right? So now he's comfortable, he has a sensation of what this feels like. Truth be told, is any inflammation, any irritation, any pain, this will produce a sensation to them. So I'm going to go, he's at a level 6, we start with patients, and I'm still going to start off the area, and then I'm going to try gentle pressure. I'm going to go right up the area. Start to feel it.
You guys feel it together, and you go over there, and the great thing about this being broadly focused is you can't really go
That's
200 of those. You can
That's right.
not get good outcome.
And right now we're scaling.
You're looking for
He's at a 4. So what I did is I just did a quick visual analog scale with him and said, hey, where you at? 1, 2, 3, or 4. And they will only reproduce pain over that. Really pain. So right now, I found that area. I've done a little plantar speed. Right, I didn't go into the plantar aspect. Right on the lateral and TJ. Right there. A little bit more this way. See how he's guiding the treatment? Now he's like telling his thumb go this way. So that's right there. Yeah, I bring him up one more level. Right up, I'm on that hot spot. I'm going to treat that for about 200 impulses. I found it in 200. And I'm just going to give some gentle, a little bit higher. So he's at 3, you can bring him on 3.5 to show the audience. And you can hear different speeds. And this isn't like a radial pump at the top. Now there it is. What I found is right over the articulate. Down right on the video. See that? That's it. Now we really found it, and this inflammation from the articular. Right? So right now, I'm going to treat this entire joint line. If I put my hand here, it will go right towards the foot of my hand if I have a job. And if I was on this medial calf, go and I'm going to do okay. So now I turn it down, right? Better? Very different other devices, sending an operate right through the body. that.